So here we are again. It's the Head Cast, and we're in Season 2, Episode 8. And the title of this episode is Why Am I Triggered? Chris, what's the word of the day?
Intimidation.
Okay, so tell me more about how that's related to this episode.
Well, it comes from the Latin word, medieval Latin word, Intimidos.
Okay.
And what Intimidos means is to make afraid.
Okay.
And that takes place frequently in the workplace from people that have been traumatized and then subsequently triggered back into the symptoms of PTSD.
So that's what I wanted to ask you. Can you explain what triggering is?
That is a great question. It's the same word as a flashback. And what that means is that re-experiencing the event. Flashbacks were first described with LSD. You would take LSD and some months or years later, you would have a flashback to re-experience what took place.
When you were on
Yes,
acid?
exactly. Particularly if it was traumatic.
Okay.
So, the people get traumatized, and then if they confront somebody that reminds them or behaves in a way towards them, the trauma, like I say, it's triggered by that event, even though it's different than what previously had happened.
Okay, so it's triggering an emotional response or something that was created emotionally.
Yes, exactly.
Okay.
So the definition of post-traumatic stress disorder, or PTSD, is number one, people have nightmares or memories that are disturbing, and we see people all the time that have nightmares and they're having trouble sleeping.
Yep.
Right?
Yeah.
And tell me, have you seen a lot of this over the years?
Yeah, so we have basically a pipeline of patients coming from what is called the Operational Stress Injury Clinic, which is in Canada a whole system across the country for the military. So all arms of the military,
right.
And the RCMP, the Royal Canadian Mounted Police. So we see these people. Pretty obvious the triggers, either war or quite traumatic events that law enforcement officers would see. And I didn't know that the primary sort of symptom in PTSD, I would have thought you would have talked more about depression, anxiety, as opposed to nightmares, because this is what we see, is terrible nightmares.
Yeah, and those nightmares are based on memories from the event, and they can be triggered by if you're working where you're being exposed to trauma, paramedics, firefighters, police, and particularly the original PTSD was based on shell shock or combat,
Right.
Where most of the research started. But now we're recognizing, well, if you have a life-threatening event, like rape, terrible car accident, or witnessing somebody that has been in a terrible place that was certainly life-threatening, you get the first symptom is the memories or nightmares.
Okay.
Because if you have the memories, that is bad, but if you have nightmares and can't sleep, then that lends itself to other symptoms that include trying hard to not have a memory, but also some people won't even go to sleep because they're afraid of having a nightmare.
Yeah.
And then things like feeling numb or detached. People that have been through a trauma, they come up and talk to the average person, they're going to be thinking, this person has no idea what I have
What
been
I'm
through.
experiencing, yeah.
Well, yeah, what I'm experiencing, but even more so, if I brought it up, they wouldn't understand.
They couldn't relate to it.
Exactly. And I don't want to bring it up, and that's why a big symptom of PTSD, which is also a big symptom for depression, is that the person won't leave the house.
Right. Yeah.
That's why dogs are so effective in getting you out of the house.
Okay.
And you're not afraid of somebody bringing up the story of, geez, weren't you in the military? More, what kind of dog is that?
Right.
I've had a dog like that.
So truly, that's the value of the service dog.
Oh, absolutely. It's a gigantic. Oh, and the other thing is that's a good question. The service dog, or any dog, has to go outside to eat.
Yeah.
Has to go outside to relieve themselves, but also they got to have exercise so they can meditate at the same time. And and then they also, you've got to feed it. So when a person feels valuable and they can care for
something
someone,
else,
that makes a big difference.
These are really subtle things, that are very important.
They are
human behaviors.
Yeah, and the reason they're important is because they've been with us since caveman times.
Right.
And so other symptoms are, and in particular, I'll just say this: if it is an interpersonal experience, somebody behaved in a way that you just couldn't believe they could have treated you that way. In particular, the first place where we look for this is rape. Rape is very interpersonal,
Right.
Whether the person is known or not.
Right.
And that makes for more nightmares, which is, yes.
It raises the emotional intensity of the experience to a whole other level.
To this whole other level.
Yeah.
And so, for example, a big part of treating PTSD, the most important thing is helping the patient feel like they've got some sense of control.
Right.
Because when this occurred, the person wasn't in control.
Okay, so how does intimidation play into the experience of trauma and triggering? Like, how does that happen?
That's a great question. I worked for an insurance company, looked at medical disability where people couldn't get back to work. And often enough, I would think, well, this person is too sensitive, and if they can only assume, that their supervisor isn't trying to ruin their lives, be disrespectful. It was what I learned as time went by is that the adverse childhood experiences, which there's a scale for it, those experiences are always life-threatening for children.
And they can be triggered.
Well,
as
yes,
an
they
adult.
can be triggered later. And the reason it's always life-threatening to them is if they don't behave in the right way for their parents, let's say, then they know they cannot shelter themselves, they cannot find enough food, and they can't even buy clothing. So it's life-threatening.
To a child.
To the child.
In their perception.
And their exactly. Which is, but is also a fact. If you said to your grandson, I want you to go out and take care, learn how to take care of yourself.
On your own.
On your own.
Yeah.
Even the grandchild, no matter how old they were, would look up at you and say, what are you
nuts?
must be. Exactly, that's the correct. Yes. So anyways, it was adverse childhood experiences.
Right.
And then you get triggered because your supervisor is behaving or even can look like your
The
mom,
perpetrator
dad,
of your,
uncle,
yeah.
whoever it, or could have
So
been
it's not
bullied.
necessarily the fault of that person. It's
That's-
what they bring out in the individual.
That's right. And that's why, as a psychiatrist, you've got to be able to say, look, they're not too sensitive. We're going to help the person get the kind of treatment for like PTSD so that they can get back to work, because working is better
Right.
than not working.
Right. Yeah, so most of my experience, of course, is in military or paramilitary, which is so obvious, right? Or healthcare.
Yes.
Healthcare workers, first responders. So this is in a whole other realm where just the average worker could be exposed to this setting in their work environment, right?
Yeah.
And so what is it about the work environment? So we've already said that it may not be the fault of the individual in the work environment. They might have just reminded the individual of something. But are there work environments themselves that are triggering?
Oh, absolutely. There are work environments that we know are toxic, and
Okay.
ever since COVID, people have focused more on, I don't want to work for people that can't respect or accommodate to who I am. And companies are really moving forward in terms of trying to provide the best environment. There's a labor shortage, and
So they're forced to do it.
They're
Yeah.
forced to do it, but also they're better off if they
Doing
do
it.
it, because they can.
But
feel good.
how do they do that? Because you're almost accommodating to every individual because they all have different experiences. So how can we expect companies to do that? Like, how do you do it?
Well, I worked for a department. There were, I think, 35 psychiatrists, and our leader was constantly in the hallway and asking us, "So how is it going? What's happening? What do you want to do?" And that was so invigorating. That, I mean, companies like Bombardier are bent on making sure that their employees feel valued.
Okay. And so can you give me examples of ways that they might be implement or things they might be doing?
Well, one thing would be the supervisor is spending time with the
With the
individuals
workers.
and finding out exactly what's on their mind, and what's on their mind, and also even knowing personal things that you understand that you need to be maybe not working past 5 p.m. because you've got this new baby at home, and that's just very, very important.
Okay. And so above and beyond these kinds of things, the environment, interaction, what are the other psychiatric elements of PTSD that you see that require treatment from a psychiatric perspective?
Well, the most important one, I think, and why I work at this clinic, is sleep. The nightmares are very important, and also the feeling detached from people, like nobody else understands at my workplace what I'm going through, and and the nightmares is interesting. There was one of the things we know about nightmares is that they are very intense dreams, and if you have a dream, you are working on a problem of the day.
Right.
So like I say, the nightmares are a big deal. If you don't sleep, it's a big deal. Tell me what you've seen.
Yeah, so I think we are referred the patients from the psychiatrist. and it's common, and they're not sleep specialists,
Yes.
and 15 years ago the psychiatrist was left with having to deal with everything.
Right.
And now there's some help, and what's come out of this is the recognition that sleep disturbances, almost more than 80% of patients with PTSD, a full diagnosis, experience some sleep disturbance of some kind, right? The nightmares being number one. Flashbacks, number two. Okay, so nighttime or daytime flashbacks. Okay. Beyond nightmares is this incredibly high state of arousal, which is hypervigilance. Now, of course, a person who's experienced trauma is by nature going to be hypervigilant because they're always going to be looking out for trouble.
Absolutely.
And it'll be more intense the more intense and persistent the exposure has been. So if it's one event and it's in the moderate range of severity, so you didn't watch someone get killed, let's say, but
right.
you saw someone have a pretty bad accident. An example would be at a hockey game where you're happy and someone gets hit by a puck. They don't die, but it's quite traumatic to watch that happen, is not watching someone get killed by being hit by the puck. So depending on the severity of the event and then the consistency or the chronicity of exposure, their state of arousal will be higher, and then the individual themselves. They may be more susceptible to being more hyper-aroused or hyper-vigilant. That will absolutely disturb the sleep state and will create a state of insomnia where they can't sleep, which, as you know and have mentioned, the more you can't sleep, the more you make everything else worse.
Yes.
And unresponsive to the medications that the psychiatrist might be using for managing the anxiety, the depression, which is common in patients with PTSD. So that's sort of an overview of what we would see. So we focus on the insomnia. We have very specific behavioral interventions for managing nightmares. And as you've articulated beautifully, the dream state in sleep is where we actually resolve emotional distress of the day. So this is just magnified tenfold in someone who's had a traumatic event and having nightmares, right? So the nightmares disturb sleep. So the final thing I would say when it comes to sleep is what's super interesting is that there's a big overlap in the military and law enforcement population of obstructive sleep apnea. So snoring and stopping breathing is very common in these patients we see with PTSD. And the interesting thing is if the apnea is more pronounced during REM sleep, which is common, that could be the trigger for their nightmares. And when you treat the sleep apnea, the nightmares go away.
Right.
Rather than the nightmares being only related to PTSD. So people who get relief from their nightmares are quite pleased, as you know.
I'll bet. And am I also hearing from you that being stressed out has a role to play in obstructive sleep apnea?
I would argue no.
Okay.
Yeah, so stress in and of itself doesn't cause sleep apnea. It's a physiologic and anatomical problem. But if you have sleep apnea and it's not treated, it will exacerbate your ability to cope with stress.
Okay.
So that would be a more accurate way of seeing those two.
Which makes so much sense.
Yeah.
I know that with the nightmares, one of the treatments for nightmares is dreams exist to solve problems, and the neurotransmitter they're attached to is norepinephrine,
Yes. Yeah.
which is the fight, flight, or freeze hormone. Mm-hmm. And what I've heard explain is that when you have a regular problem, a dream occurs, and that's attached to norepinephrine. But if it's a nightmare, something that emerges from a trauma, the norepinephrine won't let go.
Yeah,
It just holds on.
Yeah.
And that's why they've used these medications
To
that
reduce
block,
adrenaline.
block
Yeah.
noradrenaline.
Yeah,
Exactly.
Exactly. Yeah.
Exactly.
And it does, in some patients, work beautifully.
Yes.
But in others it won't, and then you have to be looking at these behavioral interventions that we have that actually treat nightmares quite effectively, actually.
Well, it's something that I've learned recently is that experts who treat PTSD for the nightmares, they are starting to use clonidine patches. And the reason for the clonidine patches is they also block noradrenaline.
They do.
Using the patch makes the side effects of clonidine much less. And they last long enough so that it's not just the nightmares that they're treating, they're also treating the memories.
Right.
Or this hyper arousal, vigilance.
The vigilance, yeah. Yeah. If you reduce the adrenergic state, you can resolve a lot of difficulties associated with trauma. But this goes back to last episode when you're talking about getting people to relax, using breathing, meditative techniques. What's interesting in this population who have PTSD is the fact is they can't even begin the process of breathing or meditating. It's actually uncomfortable for them to attempt a meditative exercise in some respects.
That to me is a very important point because one of the things I've experienced as a psychiatrist, I used to go back and forth between, is it the pills that are important or is it the therapy that's important? It can be exercise, nutrition, all of these other aspects, meditation, and I think what I've come to, and I will explain to patients, these medications are to make you feel well enough so you can do the therapy.
The other stuff.
And then we would be aiming towards you not having to take this medication.
And that's the comprehensive approach. And why the psychiatrists are asking for the sleep help, because no matter what they do, if they don't get this patient rested, if they're missing something,
yes,
they just keep spinning their wheels, and the medications don't work as well. And we find this in patients who are depressed, just without PTSD.
Exactly.
So I think it is really important. So is there anything else that you think is of value in terms of discussing the PTSD in context of intimidation?
We've been talking about PTSD in a number of different places.
Yeah.
Chuck was mentioning the police, the military, and I've been talking about the workplace.
Yeah.
And the importance of intimidation is it's leading to this life-threatening event. And the life-threatening event, at least in the workplace, is if I lose my job, I will be unable to take care of myself or feed myself or shelter myself.
Okay, so in an occupational setting, it's just an environment and an experience. It could be from whatever that puts the person in a state of being threatened for their livelihood.
Exactly.
Essentially what you're saying?
Thank you for, yes.
Yeah. Okay. What I want to do is talk about a case that you and I have had together, and we moved to a whole other realm because Chris and I had a patient who presented with sleep disturbance to me, and then I went, "Ooh, we need to have her see Chris," and Chris uncovered the PTSD, which came from a really unique and unusual place. So why don't you tell everyone what you...
Yeah, it was a very interesting case because it came up many, many years after the event. And the event was, and this is true of probably everybody, if you have a baby, The concern is the baby being taken care of well enough? You know, and we've got these very intrinsic standards. When I used to see patients that had postpartum depression, we were taught, don't expect the patient to look at you when you're talking. They will have their eyes on the baby, which is where they need to be, because there's a lot of safety issues for babies, and that is the responsibility of the mother and the father. This person had gone through this experience that their child couldn't sleep. And it was so awful that she became so sleep deprived that she required assistance to help her take care of the baby so she could get some sleep. And 1 year after the baby had this problem, a doctor made the diagnosis of colic, which I think any parent knows that if they've had a colicky infant, that is really hard, because how do you have energy if you can't sleep? And made this diagnosis, recognized this was the cause of the colic, provided the treatment, just a nutritional change.
Right.
The baby slept immediately.
Right.
And the mother was okay, but needed to talk about it years later because she had a sleep disturbance.
Right. And that's what she presented with. And I don't recall that I even uncovered that story. We just focused on the fact that she couldn't sleep now, which is 50 years later. So it was very interesting, because when I brought this case to rounds, I looked through the chart, and this was one of these patients, you don't see them that frequently.
Yes.
And you had seen this woman so many times, I thought, oh, there must be something here, because Chris doesn't see them this frequently. And there was, and it was very interesting. And I was seeing her on the last visit, and she was, essentially cured. She was just so grateful because you had uncovered that as the source of her current state of sleep disturbance. She would just want to be aware of it, and our behavioral sleep medicine team managed her insomnia.
Yes.
We didn't even have to use medication.
Yes.
And it was done. But it was a case of PTSD.
Yeah, well, it was I think the best case that we could have ever, I could be most proud of helping somebody get over PTSD, partly because the doctor she saw originally was understandably saying, you can't be so stressed out. That's having a problem for the kid. Mm-hmm. And it was a problem with the kid that was making
her stressed out.
Her stressed out.
And it just needed to be treated.
Yes.
Yes. All right. So what's your homework? Do you have homework?
Well, my homework is essentially for people to recognize that if your workplace is toxic, thinking about, well, what can be done to make that better, to assist your employer, and employers are trying, and I think that's going to make a big difference. But also thinking, maybe something happened previously, and that's also having an influence on what's taking place with my supervisor.
Currently.
Yes.
Right. Okay. So what I want people to do who are interested in this, if they want to understand it, is to imagine a traumatic event that you may have experienced, okay? And resolved or still affects you, how it affected your sleep. When your sleep was affected, how did that affect your mood and your level of anxiety? And that event could be, anything minor, but was it traumatic to you? And then imagine those negative feelings lasting for years. So we all have different events and it bothers us for a week or 2 weeks, we get over it. But if you imagine that feeling lasting for years, that is PTSD. And I think it's important to consider the compassion necessary to engage with another individual who's had an experience like that. It takes a lot, and that person is not comfortable expressing their own feelings about their trauma. This reflection will serve you as you engage with other people who may have had traumatic events, and it will help workplaces engage with their employees with a little more sensitivity around this stuff.
Exactly.
You'll see a reaction that doesn't fit, and that should make you think, geez, maybe there's something else going on here, and maybe I should just back off and try and figure that out with the person. So that's it for today.
Thank you. It was really, I think, such an important thing to be able to recognize the different places that PTSD exists in.
Exactly.
And that there's a pejorative, a put down of triggers, but there are a whole bunch of triggers that set up people for being sensitive while at the same time not wanting to make people oversensitive.
Right. So get your heads to bed, and we'll be back next episode.
Chuck, I just want to say one thing.
Okay.
I just want to interrupt for a second.
Can you edit all this?
Please get your head to bed.
To bed.
Okay, thank you.
You're right.